My name is Joelle Fuchs. I'm a clinical psychology doctoral student. Really interested in how social contexts and environments impact health. Just understanding how people interact with each other and how they find safety. When I think of health equity, it's not only the things in which people need, but also how they effectively receive those things. People always need to be able to express their own personal needs, and we as other citizens need to respect that and actually just be open to hearing that. Particularly in neuroscience, I feel like AI has sort of existed to help provide like models and very complex models of things. So when you think of like brain circuitry and things of that nature, like our neurons sort of just connect on, it's not so straightforward as I feel like we're ever taught in school about how things work. It's this path and this. It's like, it's such a complex system, and AI can be helpful in sort of just understanding like patterns from like large data points. It just sort of helps you like overlay a pattern to make sense of how you can sort of better predict outcomes. In my understanding, that's been like the hallmark of AI. So when it comes to like neuroscience and things of that nature, when you really want to understand patterns that sort of exist in large data sets or just like having large data points, that's where it's really, really helpful. The tension that I sort of sit in with AI or just things of that nature is how representative is the original pool of data points that you're pulling the information from, right? It's really good at detecting patterns, but what's the underlying system that's even allowing it to create the patterns? Is it diverse? Like how much variation just exists? Is it encompassing all different perspectives of things? Who's in the data sets? And that type of thing. So representation is really important to me. And the tension I usually sit with and where I fall with AI is just understanding how representative something is before we make generalizations on patterns that exist. When I was working in Baltimore, I guess the environment at the time that I was working with were just adults who were living with infectious disease, like particularly HIV. There I used a lot of tools and sort of tried to understand better ways that we could implement electronically based neurocognitive assessments to sort of function as a predictor of cognitive decline. So typically, like people when they're doing cognitive assessments, one, they're very expensive, like extremely expensive, but also it's just it's time consuming. It's really kind of hard to access. And so I was working in a space in which they were trying to see if you could even shorten the amount of time that you're doing cognitive assessments, but also like, are they just as good as the paper pencil, like gold standard assessments? And I found that work to be pretty impactful in just like giving people a space to have access to an assessment, but also just give them a space to like talk about themselves, although that might not have been part of the project. I found that like having people just like speak on their experience was really helpful for them. From my own perspective, I feel like it's been impactful just because, particularly with this type of research, it forces you to sit back a little bit. There are always questions that we want to answer. There are always things that we think are really interesting, but it puts you in a space where you need to sit back and just listen to what people are saying, or issues that they might have in their area, or topics that they're interested in, what they even believe science to be, what they see scientists as, and just meeting them there, as opposed to just sort of saying that you're interested in this one thing and then going into communities to sort of pull information from them. How can we come together and share a space so that I can provide service as a researcher with tools that I know I have access to, and you provide the perspective for us to help with what you feel like might be questions.